Post-endoscopic retrograde cholangiopancreatography, ERCP, pancreatitis, PEP, is the most frequent and serious complication of ERCP procedures, occurring in approximately 4% of unselected patients and carrying high risks of morbidity and mortality. Furthermore, the frequency of complications may approach 30% or more depending on the presence of risk factors. Pharmacological prophylaxis of PEP has been the topic of several investigations in recent years. However, chemoprevention of pancreatitis remains controversial. Many pharmacological agents, including nonsteroidal anti-inflammatory drugs, NSAIDs, have been investigated for their potential to reduce the risk of PEP. The proposed mechanism of prophylactic NSAIDs in the prevention of PEP is the inhibition of phospholipase A2, cyclooxygenase, and neutrophil endothelial interactions, all of which are believed to play important roles in the pathogenesis of acute pancreatitis. The results of several randomized controlled trials and meta-analysis provide evidence of the efficacy of NSAIDs for reducing PEP. The most recent meta-analysis demonstrated that the NSAIDs were associated with a lower risk of PEP in 7 high-quality studies. Relative risk, 0.58, 95% confidence interval, 0.44 through 0.76, p less than 0.001. Consequently, NSAIDs are the only drugs with proven efficacy for prophylaxis against PEP in the European Society of Gastrointestinal Endoscopy guidelines, although they are not mentioned in the American Society of Gastrointestinal Endoscopy or Japanese Society of Gastrointestinal Endoscopy guidelines. The advantages of this prophylaxis are its low cost and the possibility of on-demand treatment. In addition, NSAIDs are easily administered, and they display a favorable risk profile when given as a single dose, making them an attractive option for preventing PEP. The majority of clinical trials included in meta-analysis demonstrated the beneficial effects of only rectal administration of NSAIDs. To the best of our knowledge, there is only one small prospective placebo-controlled study in which parenteral intramuscular diclofenac tended to prevent PEP in a subgroup analysis of patients without sphincter of ODDI dysfunction, SOD. This benefit did not extend to the whole group. Rectal indomethacin is more expensive than parenteral NSAIDs, and it is not readily available in Korea. The aim of the current large-scale, randomized double-blinded study was to determine whether prophylactic intramuscular diclofenac reduces the incidence and severity of PEP in patients undergoing ERCP. Background and study aims. Rectal nonsteroidal anti-inflammatory drugs have been shown to reduce the incidence of post-endoscopic retrograde cholangiopancreatography, ERCP pancreatitis, PEP. The aim of the study was to determine whether intramuscular diclofenac reduces the risk of PEP. Patients and methods. Patients who underwent ERCP were randomized to receive either 90 milligrams of diclofenac or placebo by intramuscular injection immediately after the procedure. PEP was defined as elevated serum amylase levels, at least 3 times the upper limit of normal 24 hours after the procedure, associated with new or worsened upper abdominal, epigastric, or back pain. Results. In total, 300 patients were randomized, and 343 were eligible for analysis. The 2 groups were similar regarding clinical and demographic factors, as well as patient and procedure-related risk factors for PEP. PEP developed in 20 of 170 patients, 11.8%, in the placebo group, and 22 of 173 patients, 12.7%, in the diclofenac group, p equals 0.87. Multivariate regression analysis failed to illustrate that intramuscular diclofenac prevented PEP. Odds ratio 0.79, 95% confidence interval 0.39 through 1.25, p equals 0.51. Conclusion: prophylactic intramuscular diclofenac had no beneficial preventative effect on PEP.